For many women, this is a very serious condition as it causes a lot of pain. Today we want to talk about the pathophysiological mechanisms behind it, the epidemiology, and also what those women suffer. Hello and welcome back. So what is endometriosis? Actually, we're talking about a condition where cells from the endometrium grow outside of the uterus. The estimates differ, but it's thought that about 5 to 10% of the female population might be affected. Further 10% are asymptomatic and another 10% go undiagnosed. So disease onset is usually in the 30s or 40s, but it also might occur at a younger age. The recurrence rates are up to 50% within 5-year periods, and usually the disease ends as soon as a woman enters menopause. Now, for the pathophysiological aspects, the causes are still not clear, but there are various suggestions. So, for example, the retrograde menstruation, which means the blood flows back into the pelvic cavity. Then the cells adhere to the nearby tissue and start to grow. It's also possible that it has something to do with an immune system disorder, where the body is no longer able to recognize endometrial-like tissue, or that cells from nearby tissue start to form endometrial-like cells, promoted by hormones or again immune factors. So the tissue outside of the uterus still responds to the hormonal changes and starts to break down, as does the endometrium, which causes bleeding within the pelvis. And this blood then causes inflammation, scarring, and also swelling. For the phenotype, there are two important symptoms, which are infertility and pain. And the estimates say that about 1/5 to 1/4 of those affected are asymptomatic. So 40% of women with endometriosis are infertile, not only due to the problems with conception, but also because the pelvic anatomy might become distorted. The pain episodes are common and recurring, and is not limited to the pelvic area, but might also include legs and back. So the severity of the pain varies greatly between individuals and are most intense during menstruation. But they might start even before someone has their period and last longer than that. The women might bleed excessively, and it's also possible to have bleedings in between menstruations. It's also possible to experience pain during or also after sexual intercourse. Now, diagnosis is not as straightforward as it could be. Health history and physical examination might lead to a physician to suspect that it's endometriosis. However, the rate between the first doctoral appointment and the definite diagnosis are 7 years. We have different ways of visualizing the pelvic cavity, like a magnetic resonance imaging, better known as an MRI, and ultrasound. We also have a laparoscopy, which is a surgical procedure where a camera is used to examine the inside, and this gets applied to have a definite diagnosis. Endometriosis can be classified into stages 1 to 4, whereby 1 is the mildest and 4 the most severe form. Now, unfortunately, endometriosis is incurable, but there are various therapeutic interventions. The main goal in general is a consequence of the symptoms, so we want to prevent disease progression, relieve pain, and restore fertility. We have hormonal treatments to reduce pain and the recurrence rates, whereby even the classical hormonal birth control is an option. And it's also feasible to prescribe painkillers or immunomodulating agents. Of course, surgery is also an option where the tissue gets removed, the anatomy restored, or adhesion devised, but this type compromises significant risks, including infertility and chronic pain. And what one must not forget is that there are medical implications, of course, but it also might cause severe psychosocial stress, especially as it's harder to get pregnant. And not all physicians take women seriously, and they also might indicate that their symptoms are physiological and cannot be taken that seriously. This was a very brief overview of this very tricky disease. If you enjoyed this video, don't forget to give it a thumbs up and to subscribe to the channel to see weekly uploads on highly relevant scientific topics. See you in the next video.